Everyone has something they are passionate about and love, so why risk never being able to participate or do that thing because you did not take a concussion seriously? According to the Brain Injury Association of America's official website, there are many side effects that can be impacted, like reasoning and judgment. For adults, these side effects may be noticeable in the first couple of months, but for children, it may take years before the effects from the injury become apparent. A concussion is any strong force that can cause the brain to move and possibly hit the skull. This can be anything from a car accident, a fall, or from an exercise, or from a sport. The movement of the brain causes the symptoms the person might experience. A major problem with concussions is that no two are alike, and treatment and symptoms vary from injury to injury. According to Center for Disease Control and Prevention, in 2014, there were about 2.87 million traumatic brain injury related emergency room visits, hospitalizations, and deaths. This was found on their official website and was last reviewed in 2019. Concussions are extremely serious and can have symptoms that can leave permanent changes to a person. Today, I would like to provide you information about the symptoms, the treatments, and the precautions you can take to prevent a concussion. Concussions have 3 different groups of symptoms that can be apparent with any injury, and these are physical, cognitive, and emotional. Someone may experience only one or all 3. It just depends on the person's lifestyle and how hard the injury was. Physical symptoms are fatigue, balance issues, seizures, headaches, dizziness, and light sensitivity are the 3 most common. Slurred speech is another one that's slightly common, and that's only a few. The cognitive symptoms are symptoms that affect the brain's reasoning and understanding. Some of these symptoms are, but not limited to, having a short attention span, not being able to concentrate, judgment issues, and slow thinking. Emotional impairments can be anything to do with someone's moods or feelings. These symptoms can be anything from anxiety, mood swings, denial, and it can even affect your sleep. Now that you know about some of the symptoms, I am sure you're wondering what the treatment is like. So, this moves us on to our next topic. One of the most common treatment methods is rest. And that is by limiting your regular activities, cutting out all of school or work for some time, and not doing anything physically exerting. And then slowly, with approval from a doctor, you'll ease back into your daily routine. Another method that's starting to become more common is having physical therapy. There are several different types of therapy, including vision therapy, neurooptometric rehabilitation, vestibular, exertional, and cognitive behavioral therapy. The cognitive behavioral therapy is great for learning coping mechanisms and how to deal with the other symptoms. The vision therapy is for when you have dizziness or when you can see the stars. And the vestibular is great for balance issues. Published in 2019 by Dr. Robert Cantu, Director of Clinical Research at the Cantu Concussion Center, states that often patients will try multiple of the different therapy methods unsuccessfully before finding the right one. He also says that it may take a while, but every concussion is different. The treatment options vary greatly, and the symptoms are no fun. So next, I would like to provide you with some preventative measures to reduce your risk of sustaining a concussion. In February of 2020, the Mayo Clinic shares that proper fitting, well-maintained sports equipment, buckling your seatbelt, exercise, and having a well-lit home and keeping anything off the floor that might cause a fall are some good measures to reduce any chance of a concussion. Another great preventative method is to gate off stairways and install window guards, especially if young children are in the house. One last way to help prevent concussions is to educate others, especially parents, coaches, and athletes, to help spread awareness so they will know what to suspect if anything should happen to you or a loved one. In conclusion, there are many ways to prevent concussions. Concussions are extremely serious and can have symptoms that can lead permanent changes to a person. Today, you have learned about the different physical, cognitive, and emotional symptoms like headaches, judgment issues, and mood swings. The different treatment methods, whether it is just rest or one of the therapy methods mentioned earlier. Treatment can be a long process, so it is best to avoid it altogether by making sure equipment is maintained and fits properly, exercising, having a well-lit home, gate-off stairways, and guard windowsills, and to educate others. I hope you take away from today the serious complications that can occur from a concussion.